Today we're going to do full mouth extractions using the physics forceps, the entire maxillary dentition that is badly decayed, and the mandibular dentition. And then at the end of the procedure, we're going to go ahead and place 2 dental implants in the symphysis region, in the cuspid region, to support eventually an overdenture. So to begin, let's show you what we have to work with. Thank you. And you can see we have a lot of broken down teeth. We do have some fully erupted mandibular teeth that we will also extract. The first thing I'm going to do is I'm going to take a burr on a high speed, and I'm going to flatten the palatal surface of each of the roots. This allows me to have a purchase point for the physics forceps, which I will show you right now. There are several designs of the physics forceps. We have a maxillary anterior design, a maxillary right, and a maxillary left design. We also have a universal mandibular physics forceps. For third molar extractions, they also have another set of third molar physics forceps, but we probably won't use those today. We can demonstrate that at a future time. But you can see the forceps has a metal end that's squared off, and so that's why I want to take a burr and just kind of flatten the palatal surface of each of the roots so that we develop a purchase point. We have a bumper that will fit onto the facial bone as far apical into the vestibule as possible, and we'll demonstrate how this works and how simple the procedures can be. So let's go ahead and take our high speed and flatten the palatal surface of each of the roots. Go ahead and section. And I'm going to start, you can open real big for me. And I'm going about 4 or 5 millimeters, 6 millimeters subgingival. Here's a root that doesn't have a lot of coronal portion to it. And just simply creating a little purchase point very simply on each of these. So for demonstration, let's start with the anterior teeth. Thank you. Let's start with the anterior tooth for demonstration. So we're going to take the flattened portion of the physics forceps and place it as far subgingival on the palate as possible. We'll start with this lateral just for demonstration purposes. And try to put the bumper as far lingual as possible. And you can have a little purchase point with your finger here. And what I'm doing is simply rotating my wrist. I am not putting a lot of pressure on the forceps. It's not like a typical forceps, and you're going to feel as I'm just rotating my wrist towards the patient's eye almost. And it may take a full minute, which seems like a long time for us dentists. Chin up for me a little bit, thank you. And just kind of hold it there. Slowly, slowly, slowly. And it just kind of broke there. You can see it move a little bit. And it just kind of snapped. Now the trick or the secret to success with this forceps is to simply take your time. We can't rush into these extractions. We're not using physical strength, we're using leverage. Fantastic. And you can see we have the tooth taken out, very long lateral incisor, but we've maintained the buccal plate intact. Now this is very, very important if we consider dental implants. Our extractions need to be atraumatic, and we need to maintain that facial bone as much as possible. So one down, let's keep moving forward. Let's go to, here's a decayed cuspid tooth. Let's see if we can do this one as easily as we did that lateral. Now, this one's pretty broken down, as you can see, and I'm not using a lot of force. I'm very gently holding the handles, as you can see. Very little pressure, but I'm just rotating my wrist. And it could take up to a minute. Again, that's a long time for us dentists. We're used to using our strength to extract teeth, and that's not our intention here. It's simply leverage. Almost like a bottle opener. And you just saw that little pop, where I felt the pop. Wow, and that was a cuspid tooth. And I'm just using an instrument to grab on and simply again, look at that. Look at that curved root on that cuspid tooth. Very long cuspid tooth, rotted to the gum line. You can't be any prettier than that. Keep moving forward. Now I'm going to switch over to the upper right forceps, which just is a little bit different design, but same basic principle. And again, a very rotted bicuspid tooth. And let's see how this works. Placing the flat end of the forceps subgingival, placing the bumper as far apical in the buccal vestibule as possible. You can have a little purchase point there, but I'll take my hand away for demonstration, and I'm holding the forceps very lightly, and I'm simply rotating my wrist. Not using any arm pressure at all, simply rotating my wrist. This tooth is pretty rotted here too. I'm going to stop for a second here, and I'm going to just give a little bit deeper purchase point. See if we can demonstrate this a little clearer. And I'm just going a little bit deeper there, see if I can catch some of the stronger tooth. And simply rotating my wrist. Slow, slow, slow. You want to go fast as a dentist. That's how we were trained. But this is a different technique, different protocol. You see that? I'm going real slow right now. That tooth is moving out. Just taking a, again, very rotted tooth here. Okay, I'm going to slowly take this tooth out. And you can see I didn't use a periotome or anything here. Two rooted bicuspid tooth, maintaining the buccal plate completely. This is really magical. Okay, next one. Very, very rotted tooth. If you can turn your head just a little bit. And let's see if we can get up there. Again, I'm trying to get that purchase point really deep. Putting the bumper deep into the vestibule. Trying to get a purchase point. This is pretty rotted. So I'm kind of just leveraging my hand. Not using a lot of pressure with my arm, simply a rotating of my wrist. If I can get that purchase point. See if we can get this root out. And actually I can feel it release. And you can kind of see that, I think. And tiny little root there, taking out the apical cyst also. Okay. Now here's a molar tooth way in the back, and we're going to use the same procedure. Sometimes these are a little bit more difficult. To get the leverage, but we're almost halfway done. If you can put your chin up just a little bit, and again, not using a lot of pressure with my hands, simply rotation. Taking my time. You can't rush this. And it may take up to a minute, but it's an atraumatic extraction. Chin up for me again, please. Thank you. I'm going to try to get a little bit better purchase point on this one too here. A little bit deeper there. It wants to slide off a little bit, and so I'm just kind of flattening that surface a little bit. A little more secure there in my flattening. And I'm simply rotating my wrist, rotating my wrist. And you just have to take your time. And I'm going to go real slow here. I'm not putting a lot of pressure. I'm going real slow here. The tooth just broke through. I'm going to have you straighten your head, please. Thank you. I know I'm pulling you towards me. And you heard the little snap. And the tooth is pretty much taken out atraumatically. Look at that. That is amazing. Look at that root structure, how thin those roots are. Fully erupted tooth. We're able to get it out with very little stress. Wow. Okay, let's take a little breather here, just a little tiny breather. Are we doing okay?
Mm-hmm.
Not as bad as you thought, huh?
No.
No. Okay, so let's move forward. We're going to go back to the front area and we'll finish the remaining teeth. Again, very decayed, central, using the maxillary anterior physics forceps, grabbing onto the flattened portion of the palatal, and just rotating my wrist. I have a little purchase point on my finger. I'll take it off for demonstration purposes, but and it just kind of pops, and you can feel it pop. Boy, that just jumped out. Did you see that? Tooth just jumped right out. Wow. Okay, moving forward. Another very badly decayed lateral incisor in the maxilla. It's very soft, so I'm getting that purchase point kind of deep, and just using very light rotation. Not really grabbing onto the forceps really heavy, and just kind of rotating my wrist. It's like a bottle opener kind of motion. And it kind of pops. This one's really decayed here. And you kind of heard that pop. This is really, really soft underneath here. So I'm having a little problem there. Okay, that one's not going to jump out, but we loosened it. And again, beautiful extraction. Simple, atraumatic. Okay, let's keep moving forward. Cuspid tooth. Or that's lateral. That was another central tooth. Here's a lateral tooth. And this one is, I think we already loosened it with the other extraction there. So we'll get this lateral out. And just rotating, rotating, rotating. Pop! And another anterior tooth is removed fairly atraumatically. There's a nice little twist on that tooth too, which we didn't damage at all. Alright, now we're going to get this cuspid. And this is a fully erupted cuspid. Let's see if we can demonstrate this really clear here. And same motion. Linda, can you pan back just a little bit? I want to show my hands. Let's just demonstrate my hands. I'm holding onto the forceps very lightly. That's perfect. And I'm really just holding it with two fingers. And I'm rotating my wrist, rotating my wrist. Not really using any arm strength at all. So as far as being tired, you really don't get that fatigue, arm fatigue, with this type of procedure. Just have to take your time. heard the snap. Okay, we can come back. And again, maintaining that buccal plate completely. That's a long-rooted cuspid tooth that was extracted with very little difficulty, very little trauma. You got even a little hook on that tooth. Just beautiful. Now you want to make sure you're using the right forceps for the right area. Now here's a bicuspid tooth that's rotated 90 degrees. So let's see how this one works out with our physics forceps. Getting the purchase point, putting the bumper way into the vestibule as tight as you can, and again just using finger light pressure, and all of a sudden pop, and that tooth is out in a matter of minutes. Wow, look at that. Is that amazing or what? Maintaining the buccal plate completely. Alright, we have two more up here. And again, very badly decayed second bicuspid tooth, and let's see how well the physics forceps works in this area. Now, it's a little bit hard to see with my hands, but pop! Wow, matter of seconds on a tooth that is very subgingivally decayed. Just not a lot to grab onto. And I would probably challenge you that conventionally you may have to remove a lot of bone to be able to get a small root like that that's just decayed subgingivally. And one more fully erupted. And again, a little tricky getting back here. Try to do this so you can see it. I apologize there. You're going to have to pull that out, Sharon, please. Thanks. Oh, that's much better. Okay, grabbing onto that purchase point, subgingival on the palate side, trying to get up in that vestibule as much as possible. Let's see. Turn your head to me a little bit. Away from me, maybe. There you go. There, that's much better to see. Okay. Have my purchase point, and just rotating my wrist. Turn. There you go. It's coming. You can try to see it, see it, see it. Don't bite down on me yet. Almost finished. And the tooth is coming out. Wow, almost jumped out at me. Got a big piece of infection there. And a nice 3-rooted tooth in one piece. Amazing.